Okay, good morning, everyone. Thank you and welcome back from your break. If you can go ahead and take your seats, we're getting ready. We ended on time, so we want to keep this moving according to schedule. So as we move into session 2, we're going to be entering that organizational and community levels of the socio-ecological model that myself and Marshall spoke about earlier today. And so I'm going to hand things over to our incredible moderator for this session, Dr. Nadine Barrett, a medical sociologist and assistant professor in the Department of Community and Family Health at Duke University's School of Medicine. So with that, Nadine.
There we go. Good morning. Thank you so much. We are very excited to be here, most certainly thrilled about this topic. And again, thank you to all in the planning committee for really putting together a program where we can really both learn, but also really start thinking about what's our next steps in advancing health equity, particularly for those with serious illness and chronic disease. I'm also pretty excited because we have a phenomenal panel here who have diverse perspectives, and this particular session is focused on the community and the organizational perspective. And so we'll be putting those two things together here. You'll hear a constant theme throughout each of the groups, but yet their perspectives are very different, and I think that this will also add to the work as well. So very excited about that. First, we have, sitting next to me here, Sister Anne Francione. Sister Anne Francione is the Executive Director of Whole Kids Outreach, and she'll be speaking more about that, the great work that they've been able to do despite many of the challenges associated within that particular community. We also have Adan Maricias. He is a community health worker and patient navigator for Familias en Acción, and we are very excited about this work, particularly since we've already been hearing some themes about community health workers. So again, we'll be able to hear specifically around that and also about navigation. And then we have Sandy Chen Stokes. She is the founder of the Chinese American Coalition for Compassionate Care, really doing some national and international work, providing toolkits and support for people to really think about how to provide culturally tailored work to bridge the Chinese community, Asian community, to advanced care planning, palliative care, et cetera. So as you can see, if you look within your booklets, you'll note that there are great bios for each of the speakers, so you can learn more about them. But because we want to hear about the great work that they're doing and also think about what's the next steps, we'll go ahead and move forward with first, Sister Anne Francione.